Hello, my name is Bethany Hendren. I'll be doing my presentation off of the Healthy People website, and I picked the issue of overweight and obesity. So first and foremost, I want to start by giving the definition of obesity. It can be defined as a BMI greater than or equal to 30. Right here to the left, I put a chart of what BMI looks like. I do want to throw out there that many sources say that BMI is not always exactly accurate. This is just what people go by, many healthcare professionals, but I do want to just say that. So I wanted to start off by giving some facts about origin, scope, prevalence. I wanted to put many different statistics in here, so a lot of these statistics are the same thing, but from many different places. So from the Healthy People website on being overweight and obesity, it says that 2 in 5 adults have obesity, 1 in 5 children have obesity. Obesity is an essential health issue to address. Obesity is linked to many serious health problems, which may include type 2 diabetes, heart disease, stroke, and some forms of cancer. Another source that I used said 36% of adults have obesity, 17% of youth have obesity, and something really important to know is obesity trends affect racial and ethnic minority groups at much higher rates. And from another source I got, it says that 39.9% of adults have obesity. Obesity can also be found 18.5% in youth, and the prevalence is that obesity is much higher among middle-aged adults versus young adults. Obesity is also higher among Black people and Hispanic people versus white and Asian adults. I'm looking at some statistics. The trends show that from 1999 in the 2000 year, that the obesity trend has increased during 2015 to 2016. Some of the current treatments and interventions that have been implemented mainly address clinical, behavioral, or educational issues. However, in the past, there has not been much attention to environmental factors and the social determinants of health that I'll be speaking about later. So one of the big ways that I found throughout research is that the Healthier U.S. initiative was launched by President George Bush in 2002. This initiative mainly talked about getting exercise every day, being active, just the typical things that you would tell someone for them to live a healthier lifestyle. The Weight Control Information Network was provided to give evidence-based information about obesity to the general public and the media. So this was being given as something that everyone could use, basically just trying to educate. Some government policies and programs that were implemented started to mainly include nutrition labeling. They wanted to change marketing efforts, so some of that could include just pushing more things that looked healthier, whether that be on commercials, more throughout the news, anything. Calorie labeling in restaurant menus started, and federal efforts to increase access and financing for fresh food, fruits, and vegetables. So a social determinant of health can be defined as the conditions in the environments where people are born, live, learn, work, play, worship, and age, and they affect a wide range of health, functioning, quality of life, and different risk. So these things can be grouped into 5 domains. economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, social and community context. So some specific examples of social determinants that I'm going to talk about in the economic way is poor access to nutritious food and low healthy food spending. So I say this is an economic issue because many people do not have the financial stability to be able to spend as much money on food or make healthier choices getting nutritious food. They may be able to buy food, but it's not nutritious and it will not fully keep you stabilized and help you as much as someone would need. And another thing for community level is there may be food deserts and transportation challenges, limited parks and sidewalks, and fear of crime in public spaces. So while thinking about in a community and where someone lives, many times there are food deserts, especially where people of color live, and that's really important to relate back because in the statistics it shows that people of color are more likely to be affected by obesity, and I think this is a really good connection to make because food deserts are more likely around where people of color live. And also you have to think about transportation challenges. So, can someone drive their car to the grocery store or further away to a farmer's market to get food? What if they don't have a car? Also, we have to think about public transportation. How hard would it be to take public transportation? How long would it take? A bus ticket, whatever is needed, bringing all those groceries back. And then some communities may not have enough funding to have parks and sidewalks, which it shows that, it's essential to have proper exercise. That might be really hard to have when there is limited parks and sidewalks. Another thing within communities could be a fear of crime in public spaces. People might not be as likely to get out because they're scared of crime. And then another social determinant, one of the domains, was access to medical care. Many times people have restricted access to medical care. So this means that people might be less likely to be able to get these preventional services. Or if they do find out, they're at risk for obesity, they're not able to go back to the doctor and get help from many different healthcare providers that are needed to help with this. And we also have to look at psychological stress and structural racism that is embedded through America. We really have to think about people of color and the structural racism that is all throughout America and history, and how this can be a very big determinant of someone's healthcare quality. Some ways that we can achieve better health equity is addressing the Medicaid gap. There's a large number of people who cannot and do not have health insurance. Another idea I was thinking of is providers or primary care physicians. Anyone needs to really think about if someone is living in a food desert and how that may contribute to someone being more at risk for obesity. And from there, they need to be educated and make referrals for food hubs that their patient might be able to access. Another really big thing is a big social determinant was education, access, and quality. Many people want to live a better lifestyle, but they're not educated. So I think making food literacy workshops would be a really great idea. Bumping up adequate funding, because many people who get SNAP benefits, that is their sole money for their whole nutrition and all of their meals. And SNAP is meant to be partially what they need. And I believe there needs to be easier access to weight loss treatment. This could be therapy, food hubs, just anything that one would need. And I think as a whole healthcare field, we need to implement cultural interventions. This is very important as a social worker because it's a very relevant social work issue, and this is because obesity disproportionately affects vulnerable populations. We also have to look at how different populations have different access to healthy foods and safe places to exercise, and addressing obesity is an act of social justice. Social workers can be a really vital role in the interprofessional way of addressing obesity because diverse intervention is needed because obesity can be contributed to many different things. Some ways that we can be involved as a social worker is working towards improving access to public transportation, working on people getting access to information about obesity, nutritious foods, just anything that they would need, identifying and advocating for proper policies, help with stress and financial issues, and also if someone wants to start their journey of trying for weight loss or being preventative, we really need to help families and individuals sustain a lifestyle change. Thank you.